a lot of patients have aspects of their eyes that can make them suboptimal candidates for multifocal lens implants. I say aspects of their eyes. It could alternatively be aspects of their personality or disposition. I'll explain what I mean by that. A multifocal lens implant achieves a wide range, distance to near, of glasses free vision by splitting the light that comes into your eyes. Now, that light splitting is done very efficiently, but it comes at a cost. And there's a measure that we can use to assess the quality of vision called contrast sensitivity. In general, a light splitting lens can reduce your contrast sensitivity. Now, there are a number of eye pathologies which can also reduce your contrast sensitivity. Irregularities of the cornea, most common of which being dry eyes, but also structural pathologies, scarring. These things can reduce contrast sensitivity. Likewise, issues in the retina, things like epiretinal membrane or macular pucker, macular degeneration. These can also reduce contrast sensitivity. And in general, the safe conservative approach is not to layer a multifocal lens or a diffractive optic on with those other pathologies. So, in a lot of cases, patients will come into the cataract surgery evaluation desiring a multifocal lens specifically, but having one of these pathologies. And one of the things we try to do is identify these things that might make patients unhappy with the quality of their vision after surgery and see if we can't find alternative strategies or compromises to best meet their goals given the limitations that we have in surgery. So not everyone is a candidate for a multifocal lens. The other factor, and I've mentioned this elsewhere, but the other factor is personality type. Multifocal lenses are known to carry some side effect risk. For most people, this is a point of light in the dark can take on a ring-like effect or a halo around it. It's not something that everyone notices. For your easygoing or more kind of classically type B, it's not something that most of them notice at all, or if at all, just a little bit. For your more detail-oriented or type A patient, though, it is something that you would often notice, can be a factor in the surgery, and in rare cases can even be one of the reasons that people choose to have these lenses explanted. So we always encourage people to consider these lenses along that continuum as well as us doing our best to identify pathology that objectively might make you not a good candidate.